All right. So, for all those who have been able to join us, um, we're really happy that you could make it. I'm going to introduce our speaker. Dr. Moses Appel is a postdoctoral fellow at my OCD Care. Oh, I hear good things. Who specializes in evidence-based treatment for OCD, anxiety, and depression in adults and adolescents. He's also assistant professor of psychology at Touro College. He received his PhD and MA, master's from Hofstra University, and received additional training at Columbia University's Center for OCD and Related Disorders and Zucker Hillside Hospital's Behavioral Health College Partnership Program. So tonight, Moses will be discussing a certain presentation of OCD, which has a particular, which I guess we both have a particular interest in, and it's religious OCD in the Orthodox Jewish community. As we all know, OCD can have detrimental effects to living your life to the fullest, and those who are religious could have similar effects to their spiritual life. So, it's a very interesting topic. And without further ado, take it away, Moses.
Thank you. Thank you, Dr. Kamenetsky. Thank you, everyone, for joining. So today we're really going to take a deep dive into religious OCD, also known as scrupulosity. And then at the end, for whoever makes it to the end, you'll have an opportunity to ask questions through typing in your comments, and Dr. Kamenetsky will then read them out, and I'll try my best to answer them. Thank you very much for joining. This is a very interesting topic, especially for Orthodox people, because so much of our lives is really dedicated to our religion and our religious practice. And so it's really interesting to learn how specific psychological disorders can interfere with that, and what can we do about that to overcome the interference. So the goals for today's talk is going to first be to gain familiarity with OCD, obsessive compulsive disorder, more broadly, and then to understand the nuances of religious OCD, also known as scrupulosity, and then to learn about treatment. So let's first discuss some common misconceptions. Perhaps you've heard the phrase, "he's so OCD about everything," or "I know I'm being so OCD about this," or maybe you're yelling at someone, "Stop being so OCD about this." So when people use the term OCD colloquially, they often are referring to perfectionism or orderliness. And that is usually often like a personality trait or a way a person enjoys being. And it's not really distressing usually to that person. It might be distressing to people around them, but to them, it's usually not distressing. Obsessive compulsive disorder is different than that, in that the person who has OCD is actually suffering a lot. And it is very distressing. And soon on the next slide, we'll talk more about what exactly obsessive compulsive disorder is. But not only do they suffer, 44% of people with OCD have experienced thoughts about suicide over their lifetime, and 14% have actually attempted suicide at some point in their life. So OCD is a very debilitating disorder, and it's not the same thing as people usually mean when they mention someone being so OCD. So what is OCD? What is obsessive compulsive disorder? To be diagnosed with OCD, you need to have obsessions or compulsions, and usually both. Obsessions are recurrent thoughts, urges, or images that are intrusive and cause significant distress. So let's take, for example, a common case of OCD where maybe someone has contamination OCD and they're constantly washing their hands. And so they're likely experiencing a recurrent thought of, "My hands have germs on them," or "I'm going to get sick." And these thoughts are intrusive, right? They don't want to have this thought. This thought keeps entering their mind, and it causes them distress. And so what have we learned since we were little kids that to do when we're in distress? We try stop feeling that way, right? And so they engage in compulsions. Now, compulsions are behaviors or thoughts that someone engages in to relieve the distress that's caused by the obsession. So in this case, for example, if someone has this obsession that they have a lot of germs on their hands and they're going to get sick, they're likely going to wash their hands a lot. And that would be the compulsion. Or they might have like a mental game of ping pong going on where they answer the thought and they say, no, I'm not going to get sick because, the CDC says it's okay if you don't wash your hands unless you're about to eat or something like that. But then they have the other thought and they say, yeah, but maybe this doorknob is very germy, and so I really have to wash my hand. And then they go back and say, but no, the CDC knows that, and they still say what they say. And so compulsions are not only behaviors that we engage in, they're not only observable, they can also be all in our minds. And then the second criterion for OCD is that the symptoms take more than 1 hour per day or cause a lot of distress or functional impairment, which means it's getting in the way of the person's life. It's getting in the way of their work, their family, their social engagements. It's interfering with their life. So as you can imagine, we have thousands of thoughts a day, not just about germs. And so OCD can really grab onto and latch onto any type of thoughts or fears that we're having. So we just mentioned contamination OCD as an example, but let's look at harm OCD. In harm OCD, the person might have this thought of something bad might happen, like I might leave the stove on and my house might burn down. Or what if when I was driving my car and I felt a bump in the road, I just hit someone? And, those thoughts are obviously very distressing. And then the compulsions might be checking the stove 100 times, right? Or taking pictures of the stove to remind themselves later that they checked the stove. But then they might have the question of, did I actually take the picture before I turned off the stove or after? And so, as you can see, OCD can be this constant doubt and constant worrying that someone goes through, and it can really attack any part of someone's life. Other examples, which are less spoken about, but very common too, are pedophilia OCD, where someone has this constant thought of maybe I'm being a pedophile, or maybe I'm attracted to children, or if I pass by this child here, I might end up touching them inappropriately. And it's not that these people are likely to do such a thing. It's just this constant fear of what if I might. And so the compulsions tend to be to really try avoiding it, right? Like crossing the street when you're passing by a child. Or in violent OCD, someone might have the thought, if I'm near knives, I might stab someone. And so I'm going to go hide all the knives. And then there's this just right feeling that's often associated with OCD as well, which is doing something until it feels just right, even if there's no logic behind it. So maybe in contamination OCD, I'm washing my hands not only for 20 seconds, as the guidelines are, or for 40 seconds to be extra careful, but I'm going to keep washing my hands until it actually feels just right, even though logically it doesn't really make so much sense. So there is that feeling that goes along with OCD as well. So let's take a look at the OCD cycle, right? How OCD kind of perpetuates and maintains itself. There's some sort of trigger. Maybe I'm touching a doorknob, and all of a sudden I have these thoughts of, I'm going to get sick. I have germs on my hands. And these obsessions cause an increase in my anxiety levels, or disgust levels, or fear, or worry, any type of strong emotion that I'm experiencing, and it's causing me a lot of distress. And so in response to the distress, I engage in a compulsion, maybe washing my hands or convincing myself that I'm not going to get sick. And ultimately, that provides relief. But it provides temporary relief, not permanent relief. And then the cycle repeats itself. And not only does it repeat itself, oftentimes the compulsions I have been doing aren't good enough. And now I need to wash my hands for 2 minutes or 3 minutes. And now that I'm paying so much attention to having germs on my hand, these obsessions of having germs are coming back more frequently as well. And so OCD keeps repeating itself in that way. There are some underlying thinking patterns in OCD, such as the intolerance for uncertainty. So, we all have doubts, but usually we have a doubt and we move on. But people with OCD are constantly asking the question, what if? What if I have germs on my hands? What if I'm a pedophile? What if I just hit someone with my car? And that's why it's sometimes referred to as the doubting disorder, because we're constantly doubting ourselves when we have OCD. There's also a thinking pattern of giving overimportance of our thoughts. So we might have a thought, as we're passing by or as we're stuck in traffic, like, what if I just slammed on the gas pedal and drove into the car in front of me? We're never going to do it. It's not even something we want to do, but that thought crosses our mind. And so in someone with OCD, when they have that thought, they're going to say, oh my God, why am I having such a thought? Do I really want to crash that person? Am I a bad person? Am I likely to crash into the person in front of me? So that's another common, underlying thinking pattern in OCD. There's also overestimation of threat, right? Like if you touch a doorknob, maybe there's a 0.0001% chance something bad might happen. But some with OCD, they touch the doorknob and now they're thinking like there's an 80% chance that they're going to get really sick. There's inflated responsibility, right? Like if we are walking in the street and we see a banana peel on the floor, if we're in a good mood and we want to be nice, we might kick it to the side, we might pick it up. If we're in a rush, we might say, all right, who would throw a banana peel, but we don't actually do anything about it. But someone with OCD feels the responsibility to clean it up. And if they don't, then one block later, they start thinking to themselves, how many people may have slipped and fallen and killed themselves or ended up in the hospital or broke their hand because I didn't pick up the banana. And that's a constant thought that distresses them. There's also perfectionism and rigidity often found in OCD, and hypersensitive morality, feeling like I need to be a perfect person in every single way. Some OCD statistics, the lifetime prevalence is 2 to 3%. In other words, most people, like in the general population, 2 to 3% of the population will have OCD at some point in their lives. The mean age of onset, meaning when OCD typically tends to kick in, is 19 and a half years. Onset after age 35 is unusual. I remember one of the patients I treated at Columbia was a 44-year-old father who had obsessions of stabbing his kids. And this just came in at age 44 and he couldn't figure out what it was. And we actually never found out what triggered it specifically at that age. So it's unusual, but it happens. But the treatment is pretty much the same. And we're going to talk about treatment towards the end of tonight's talk. Males have an earlier age of onset than females. In fact, a quarter of males who have OCD begin experiencing OCD symptoms before they're even 10 years old. So at a very young age is when males can start experiencing OCD. And the majority of people with OCD also have other disorders like anxiety, depression, and that's called comorbidity, when someone experiences two disorders. And it's very common with OCD to not just have the OCD, but have other disorders that go along with it. The last thing you need to know generally about OCD before we get into scrupulosity and religious OCD is there's such a thing called levels of insight. And level of insight refers to how self-aware someone with OCD is. Do they recognize that what they have is OCD and it's just too hard for them to kind of break the cycle? Or do they think that they don't really have OCD and they're just being very careful about their health and other people should also be careful about their health? So if someone has good or fair insight, it means that they kind of know they have OCD, but when they're triggered, they can't stop themselves from engaging the compulsion. Poor insight is where someone knows they have OCD, but they think a lot of their behaviors actually make a lot of sense. And they're surprised that others aren't engaging in similar behaviors. And then if someone is absent insight or delusional beliefs, they don't think they have OCD. They think that everyone else is the one that have, issues. And as you can imagine, that's much harder to treat. It's easier to treat someone who recognizes they have OCD, but they're struggling with it versus someone who wants to know why everyone else is not, behaving the same way that they are. Okay, so now we got to the meat of today's talk, scrupulosity. When OCD meets religion. So religious OCD or scrupulosity is a form of OCD where the obsessions and compulsions are centered around religious beliefs and rituals. So it just means, as we discussed before, there are all these different subtypes of OCD, and OCD can affect us in many areas of our lives. So religion is one of those areas where OCD can affect. And it's important to note that religion itself does not lead to OCD. However, those who are religious and have OCD will likely experience scrupulosity. So it's not that the religion is causing the OCD, but religion is a breeding ground for OCD. So someone who has OCD and happens to be religious is likely going to experience OCD symptoms related to their religion. So this is a study from 2007 where they looked at 293 adults with OCD as their diagnosis, and they looked at what subtypes of OCD were they experiencing? As you can imagine, contamination OCD, right, was very common, 57% or almost 58% of the people in their study. But religious obsessions were at 26%, which is a significant percentage, especially given that this population was from the general population. It wasn't specifically a religious population. So you can imagine amongst the religious population, the prevalence rate is likely much higher than this. But even amongst the general population, religious obsessions do account for a significant percentage of the subtypes that people experience. The sad part is that even though it's not that uncommon, many professionals are not trained or have not come across the subtype and they don't recognize it. So when you have an issue, a medical issue or anxiety, you probably go to your doctor first and you speak with them about it. And then they refer you, if necessary, to a therapist or to a specialist. But if they don't even know what you have or that it's a disorder, that can get in the way of you getting the treatment you need. And in this study here in 2015, they asked a group of doctors, to read a small little story about someone with religious OCD. And they found that 38% of the doctors misidentified it and were not able to recognize that as a type of OCD. What's even scarier is that amongst mental health professionals, they also found a very high misidentification rate. As you can imagine, right, if they can't recognize that what you have is OCD, then of course they'll have treatment implications as well. So let's talk about some Jewish examples of where OCD can take effect. And here's a list of them, but we're going to go through them one by one just to give you a flavor of what OCD might actually look like amongst Orthodox Jews. So I'm sure we can all relate, right? We see here 2 pictures of a lot of silver foil for Passover, for Pesach. Now, of course, we all have our traditions, our ways of cleaning. Some of us use silver foil in certain areas of the house, perhaps the counters in the kitchen, but this is clearly excessive. And so Pesach in general is a time that sometimes can be, anxiety provoking for some people. You're cleaning the house, you're making sure there are no breadcrumbs anywhere. Some people do spring cleaning during this time of year as well. However, they're not constantly obsessed with the idea of maybe finding a crumb to the point where it's debilitating and they're suffering and they can't function in their life. But someone with OCD will likely go to great lengths to because of all of their obsessions about not finding any crumbs in the house. For example, it's not uncommon in people with OCD who are Orthodox to make their family members change their clothing before entering the house to make sure that there's no crumbs, right? Most of us might shake off our crumbs, might even leave our shoes at the door, depending on like how stringent a home might be. But people with OCD are going to great lengths and they're constantly thinking and fearing about their Pesach cleaning. Sukkot or Sukkot with the 4 species, the Daled Minim. So this usually is not OCD at all, right? This we find in many ultra-Orthodox communities where they spent a lot of time, hours, days even, finding and picking out their perfect esrog, or lulav, or hadassim. And so this does beg the question, how and when do we differentiate like stringent religious practice from OCD? And soon we're going to get into much more detail about that. But for here, it's just important to note that not all behaviors that seem excessive are actually OCD, right? It could be regular standard religious practice or stringent religious practice. And so the way I like to think about it, just briefly for here, is if someone is looking and spending hours on picking out an esrog, just as they might do when they're picking out a nice car or a nice watch, that's not OCD. It's driven by devotion, love for the mitzvah. They want to spend a lot of time on it and money on it. And that's a beautiful thing, assuming it's in line with their values. But someone with OCD who's looking for an esrog is going to find a beautiful esrog and is going to see that there's no spots on it, but still feel the need to go to their Rav, to go to their rabbi, to go to their religious leader and ask them, like, is this a kosher esrog, right? And so the religious leader will say, sure, it looks beautiful, enjoy it in good health. And then when the person comes home, they say to themselves, okay, but did the rabbi really look at every inch of that esrog? I don't think so. Let me go back to the rabbi. And the rabbi says, no, I saw this esrog already. And they say, okay, but let me go to a different rabbi who doesn't know me, right? who actually might take a better look at it and let me know the truth. And as you can see, again, at some point, it could become very debilitating and interfering in the person's life and actually counter to what the holiday is supposed to be about, right? It's supposed to be about simcha and happiness and doing things the right way, but with happiness, not with constant anxiety and fear driven to do what you think is the right thing, right? Dairy and meat, milk and meat. We don't mix milk and meat. And so for us, most typical homes, we have separate pots, separate pans, possibly separate sinks, separate sides of the counter even. But well, when we're putting it in the fridge, we may have them on the same shelf in the fridge, right? And even if we don't, if someone accidentally puts them on the same shelf in the fridge, we'll be fine. But someone with OCD, on the other hand, won't let anyone into the kitchen because of fear that they might accidentally touch one pot to the other pot or put it on the same shelf. Or, if they are not sure if their kid may have spilled some milk into the soup pot, immediately they call the rabbi and ask them what to do. And the rabbi says, okay, how much was it? Less than a 60th, no problem, enjoy it. But then 2 minutes later, the rabbi gets another call and the person says, I think it was that, but I don't know. Maybe it was more. Maybe it was more than a 60th. And the rabbi says, okay, but you're not sure. It's probably fine. Enjoy it. And then they call a different rabbi because the first rabbi might not be taking them seriously enough. And so again, you see how even in simple things that we're so used to keeping, and we don't really think twice about, someone with OCD is spending many hours, oftentimes, stressing out over it. Ritual hand washing, right? So this could appear to be OCD to the outside observer because in the morning, for example, we have rules about how we do it. We take the cup with our right hand, we pass it to our left hand, we pour on our right hand, then to the left hand, we alternate 3 times. And so it could seem excessive and obsessive, but that's very much in line with our tradition, with our values, with our halachas, with our laws, Jewish laws. And so that's a beautiful thing again. But someone with OCD is doing it not only one round of 3 times each hand, but then they think how maybe they missed a spot the second time they were pouring. So that invalidated the 3rd time as well. So now they have to redo it again, right? And then they may redo it again because maybe there was some soap in the cup from the last person who washed their hands there. So that didn't count, and they do it again to the point where they might be like really damaging their hands, and their hands become like with rashes or scabs and wounds. And so again, something that we don't really think much about in OCD can really take on a life of its own. Mikvah, especially for women, they prepare themselves before the mikvah, make sure there's nothing on their body. And so a typical process might take 30 minutes or an hour, perhaps a little more, but someone with OCD is spending hours and hours and checking and rechecking and rechecking. And then when they come home, then they start having more doubts of, oh, but maybe I missed something. Maybe I have to go back again, call the rabbi. And again, every part of Jewish religious life, you can see how OCD can really latch onto that. And at a certain point, it's not really practicing the religion anymore. It's the religion being hijacked by OCD. And now you're practicing OCD that looks like religion, right? And so that's where OCD takes a turn from being religious practice to just OCD practice. Just a few more examples here. Restroom use, right? So we're supposed to keep our bodies clean, use the restroom when we need it, especially before prayer. But, sometimes you see people in shul who may be like leaving the shul leaving the main sanctuary to go to the restroom multiple times throughout the davening, every single time they're there. And so there again, it's taking away from their religious practice, but they just feel like they can't stop doing it. Prayer, right? I mean, this can come in all different forms. It can be someone repeating the words to make sure that they are enunciating each word, each letter correctly. It could be someone repeating words because they feel like they didn't have the full concentration they needed, especially by certain parts of davening, by certain parts of prayer, like by Shemona Esrei, especially the first bracha, by Shema, by Posei Chasidecha and Ashrei. So there are these specific parts where we're supposed to have, good concentration. And sometimes it's okay to repeat it, but not to repeat it multiple times and then go through davening and then go back to that time just in case you didn't do it correctly and go through that iteration again and again and again. Or it might be, I had the proper concentration, but I had an inappropriate thought or an inappropriate image while I said it. So now I need to say it again with a pure mind, with not having any other thoughts or or images or anything I shouldn't be having there. And so again, you see people turning prayer, which can be a beautiful way of connecting to Hashem, of being with our thoughts, into this like terrible struggle, torture almost, that happens, if you're davening 3 times a day for multiple hours, it can really take on a life of its own as well. Taboo thoughts or images. So again, we're supposed to not keep our minds clean, not think about inappropriate thoughts, but there's a difference when they're intrusive and unwanted versus when you're purposely thinking about them. And that's the difference that some of the OCD usually doesn't make. And so anytime they have any type of inappropriate thought, they may spend a lot of time trying to undo that thought and replace a bad thought with a good thought. And again, that can be a torturous process. Sabbath observance, keeping Shabbos, right? We all know that Shabbos has a lot of its own halachas, its own laws, almost a religion unto its own. And so you can imagine how OCD can destroy someone's Shabbos, which is supposed to be a time of connection and rest and learning Torah and davening, and it could turn it into a miserable time for someone, checking their pockets every second to make sure they didn't, carry by mistake, or really any type of Shabbos law that they think or fear that they may have violated. Monetary laws, right? Did I get the correct change from the store? Did I make the donation to the shul that I promised? So you call the gabbai, you ask him, did I make this donation? They say, yeah, you did. Thank you very much. But then they start having the thought of, what if the gabbai, got my donation, but that was for 2 weeks ago, not for this week. And so I need to call back again. And so I need to donate again. Or, I used someone's Wi-Fi because, I had to check my email. Again, I'm not saying that you should be doing this, but we all have done it from time to time, I'm sure. And we don't think much about it, or maybe we feel bad and we make a resolution not to do it again. But some of the OCD will go knocking on every door in the neighborhood until they find a person who they may have used their Wi-Fi and see if they can reimburse them or pay them because they stole from their Wi-Fi connection. And this is the last example I have for tonight, which is, do I truly believe, right? We all sometimes have questions and doubts of, either our faith is being challenged or how could something happen. But this is actually a common symptom presentation in religious OCD, where someone is constantly having doubts and thoughts and concerns about how much they truly believe. And it's called faith for a reason, right? We take a leap of faith because sometimes things are not super proven or super clear, and yet we believe it doesn't really bother us for most of the time. But some of the OCD can't get it out of their heads to the point where they're ruminating for hours and hours a day, and then thinking about what it means about them, and am I a faker, and all those types of questions that can destroy someone's faith and religion because they just can't get over the doubt or the possibilities of, what if I don't truly believe, or I'm not a good Jew. Okay, so that was a quick run through of a lot of different examples of how OCD can play a role. And so one of the questions we mentioned was, how do we differentiate OCD from standard or from stringent religious practice, right? Some people have stringencies, they like practicing Judaism at the next level. And how do we differentiate that from OCD? So they actually did a study on asking Orthodox versus non-Orthodox Jews to read a story about religious OCD and see if they can differentiate what's standard religious practice versus OCD, exactly what our question was. And so the hypothesis was that Orthodox Jews would be less likely to recognize scrupulosity or OCD and to recommend treatment because of the value they place on careful adherence to religious laws. The idea being, people who are ultra-Orthodox or Orthodox in this case care a lot about keeping the laws. And so when they see someone keeping the laws to an extreme level, they may not recognize it to be OCD and instead just say it's stringent religious practice. Whereas the non-Orthodox would be able to say, no, that's clearly OCD. But the results, what they found was the complete opposite, that the Orthodox participants more often recognized OCD and recommended treatment than did the non-Orthodox. And why is that? Simple, right? The Orthodox participants knew what was actual stringent religious law, and what would be, excessive. Whereas the non-Orthodox participants likely thought it's all OCD, right? Like they couldn't differentiate. And if we see everyone's practicing it, it's obviously not OCD, so it must be it's all religious practice. But it was hard for them to differentiate the nuances between religious OCD versus stringent religious practice. And so the implications of this study is the importance of a nuanced understanding of the patient's religion. And so if someone has religious OCD and they're looking for a therapist, does not necessarily need to be a therapist that shares the same religion as them, but it should be a therapist who understands their religion very well and can differentiate with these nuances here of what's considered standard practice versus OCD. So how do we differentiate stringent religion versus OCD? So you can ask a bunch of questions, each one trying to get at this idea of, what exactly are we looking at here? One question you can ask is the person's behavior stemming from distress or from devotion, right? In OCD, it's stemming from distress. They're anxious, they're scared, they're fearful, they're worried, and that's why they're spending hours looking at the esrog, because they are so afraid if they might be using an esrog that's no good, that's puzzle. Whereas someone who's spending the same amount of time, right, it could be the same behavior, but they're doing it because they're buying themselves a new Rolex or a new car, and they're loving it and enjoying it, and they want to get the most beautiful one, and they want to, they're really enjoying it, then it would just be stringent religious practice, right? So that's a very good question you can ask yourselves or ask other people. What's the motivator behind their behavior? Is it distress or is it devotion? Another question you can ask is a person engaging in behavior that's actually counter to the true laws? Remember we gave the example of prayer where someone might be repeating prayer multiple times. What if they're saying God's name multiple times? Hashem, right? They're saying the name again and again and again. And the true laws are you're not supposed to say God's name in vain, right? You're not supposed to say Hashem's name for no reason. And so if they ask the rabbi, should I be doing this? The rabbi would say, no, absolutely not. But they still are doing it, right? So that's another good question to ask. Sometimes the OCD behavior is actually counter to the law itself that they're afraid of violating, right? Like, I'm afraid I might mispronounce it, but now that you're saying it 100 times, that's even a bigger issue. Another question you can ask is the person's overall behavior negatively impacting other areas of religious life? So maybe the person who feels like he can't concentrate on his davening, so he's repeating it many times to get the perfect concentration. What if he stops going to shul as a result of that? Or what if he cuts down on how much he davens as a result of that? So that's another good indicator that it's not stringent religious practice, it's OCD that's actually hijacking the religion and getting in the way of the person living a value-driven life, what they actually want to be living, and instead just experiencing OCD. Another question you can ask is this person only stringent regarding certain religious laws? Like, is it only when it comes to the kitchen and meat and milk where the person is super stringent, but when it comes to other parts of Judaism, prayer or Shabbos observance or other areas, they don't show this extra stringency? If that's the case, again, it lends some evidence to the idea being that it's OCD that's driving it and not religion, because if it was religion, it would be among many areas of religion, not specifically one or two areas. Another question you can ask is, if your rabbi told you to do otherwise, would you be able to change up your behavior? When people are engaging in religious practice, if their rabbi tells them something else, they follow their rabbi, they're happy, they have direction, they move on with their lives. Someone with OCD won't be able to do that for most of the time. They might be able to do it temporarily, but then they'll go back to the rabbi and ask the rabbi again. They might ask a different rabbi. And so that's another good question you can ask to differentiate stringent religious practice versus OCD. And excessive reassurance, right? Similar to the one above, when people have OCD, they tend to try to get a lot of reassurance from their family. Am I doing this right? Is it okay? Can I stop washing my hands now? Is there any possibility the meat touched the milk? And so if someone's asking for a lot of reassurance where it seems like very excessive, again, that's another indicator that you're looking at religious OCD or scrupulosity versus stringent religious practice. So that was a lot about what OCD is and how debilitating it could be. What does treatment for OCD look like? So the gold standard psychotherapeutic treatment for OCD is called exposure and response prevention, or exposure and ritual prevention. In short, it's called ERP. In ERP, there are two components. There's the response prevention component and the exposure component. Response prevention refers to refraining from engaging in the compulsions. So for example, if someone has the thought, I have germs on my hands, and they want to wash their hands, the first part of the treatment says, try not to wash your hands, even though you really want to. And of course, we help the person along. We give them other skills they can do in the moment in order to refrain from engaging in the compulsion. We build a hierarchy. So we go, from something that's easier to refrain from to something that's harder to refrain from. But ultimately, the goal is to get them to stop responding in the way they used to respond in the past. And exposure is the second piece, which is not only do they refrain from engaging in the compulsions, now we actually ask them to purposefully expose themselves to triggering situations. So go ahead and touch the doorknobs, or go ahead and pray in a shul where it's very busy. There's a lot of background noise. So it's hard for you to concentrate, right? And then, of course, refrain from engaging in the compulsion. So how does the treatment work? You remember the cycle we discussed earlier? There's this trigger, maybe touching a doorknob or starting to pray. You have these obsessions. Am I praying with the proper concentration? You have anxiety. Oh my God, what if I'm not? I'm not praying correctly. And so you want to engage in the compulsion, but instead we're breaking the cycle in this area right over here. We refrain from engaging in the compulsion. And ultimately what the person learns is two things. Number one, that they can tolerate the anxiety, right? It's not unbearable. And number two, that the anxiety tends to dissipate on its own, even without engaging in the compulsion. And the message you're sending the brain is, I don't really care much about this obsession. I'm cool with it. It's not relevant to me. And when you keep sending that message to the brain, as opposed to the message, all alarm bells are ringing, this is like terrible, I really got to respond, the brain eventually stops sending you the obsessions if you're not going to respond to them anyways. But when you do engage in the compulsions and you are responding to the brain is getting the message like, this is really important for you, so I'm going to keep reminding you of it. And that's how the cycle repeats itself. So ERP is all about breaking the cycle of OCD. So some examples of exposures for scrupulosity might be keeping the milk and the meat near each other in the fridge or on the kitchen counter. It might be pray in an area where it's difficult to maintain concentration. It might be purposely think about the possibility that you don't truly believe in God, and then instead of ruminating, which would be the compulsion, you just stop thinking about that and you go on with your life. The difference between exposures for scrupulosity versus other OCD presentations is the importance of collaborating with the rabbi or the person's religious leader. Because in OCD, with these exposures in ERP, we're trying to get to the person up to the line, but not to pass the line, not to go over the line. And so when it comes to, let's say, meat and milk, we're not going to ask them to expose themselves by pouring milk into their meat soup, right? And so some things are obvious in with regards to like what's okay, what's not okay. But many times it's not obvious. Like at what point does it become an actual avera, an actual, a sin that you're not supposed to be doing? And at what point is it okay? And even if it's maybe something that a rabbi would say most people should refrain from doing, what about someone who's trying to overcome their OCD? At what point, like how far can they go to overcome their OCD and regain their life and regain their religious practice versus at what point is it too far? That's why collaboration with the rabbi is really important when it comes to exposures for scrupulosity. So what are some obstacles, and then we'll talk about solutions in treating people with scrupulosity? One obstacle is what we've been discussing until now, differentiating OCD symptoms from normal religious practice, right? And the way you overcome that obstacle is, like I mentioned before, ask those differentiating questions that I listed earlier, and that will give you a good idea as to whether it's OCD or whether it's just stringent religious practice. Another obstacle might be that sometimes there's poor insight among patients, right? Sometimes patients with contamination say like, okay, I see the whole world is not washing their hands constantly. I clearly have OCD. What can I do about it? Someone with religious OCD might say, no, I see other people in shul praying for 10 minutes or 15 minutes, and they are the rabbi themselves, right? So why can't I be doing the same thing? And why are you saying that for me it's OCD? And so sometimes you might run up against this issue where the person has, poor insight into their symptoms, and they don't really recognize them to be so much OCD, and they think, no, it's just my religious practice. And for that, we try overcoming that by bringing attention to how OCD behavior interferes with their religious practice, right? Like I said before, maybe they're repeating God's name 100 times. Maybe they're not going to shul anymore. Maybe they're not praying as much as they would have liked to. And so that could be like a clear indicator, like, okay, this is OCD, this is not religion. Because if it was religion, then it wouldn't be interfering with my religion so much. So that's one way about going about it. Of course, you can also just give them traditional, psychoeducation, explain what OCD is. We can talk about distress versus devotion and what's motivating your behavior. But sometimes it can be really powerful to show them how what they're afraid of, which is not being good Jews, is actually happening more because of their OCD than if they didn't have OCD. Another possible obstacle can be finding exposures that don't violate Jewish law. because like I said before, right, you could find many exposures that don't, but if you really want to push them to the limit to really overcome their OCD, you want to be careful not to violate the actual Jewish law. And for that, like we said before, consult with the rabbi, and that should take care of that problem. You don't always necessarily include the patient in these consultations, because sometimes that could defeat the purpose of the exposure, right? Because if they get the heter from the rabbi, then it's not really an exposure. It's not really causing them so much anxiety, because now it's like sanctioned behavior. So it could get tricky sometimes how you navigate this line here of consulting with a rabbi to make sure you're not violating Jewish law, but not giving the patient the reassurance that they want, which is the compulsion they were doing all along, right? They were always consulting their rabbi. So you need to walk this fine line. Another obstacle could be consultation with the patient's religious figure, the patient's rabbi, who may not get OCD. They may not understand it, and they themselves might have poor insight. And for that, just provide psychoeducation or get another rabbi. Well, you can't always do that, obviously, but hopefully through psychoeducation, most rabbis can get it pretty quickly, understand the difference, and can help along with the treatment. And the last issue here can be the patient constantly reassurance seeking from the rabbi. So not just asking the rabbi one time or two times, but every single exposure, calling the rabbi and asking them. Or every time they have an issue, they're not sure, they call the rabbi and say, okay, just let me know if it's OCD or not. But that kind of defeats the purpose, right? Because if they're always being told and always being, reassured, then they're never going to be able to get out of the cycle themselves. And so in these cases, it could be helpful to, number one, implement rules for when reaching out is okay. So maybe have specific guidelines as to how many times per week you can reach out, or per month, or what types of questions can you ask and whatnot. And also to have some pre-negotiated responses that both the patient and the rabbi are on board with, so as not to give the patient the reassurance that they're seeking, so that they could actually practice this, ERP therapy. And so the response might be something like, I can't answer that question, or maybe yeah, maybe no, but you want to pre-negotiate it so that the patient doesn't feel like the rabbi is abandoning them and not answering them, but this is an agreement they come up with, so that if they end up reaching out to the rabbi when they're not supposed to, the rabbi can just give a quick answer that doesn't really answer the question, and the patient knows they have to deal with, the exposure with the OCD themselves. Here's some Jewish sources against obsessive practice. This idea of Torah nitna l'malachi asharis, the Torah wasn't given to angels. Noam, right? Her ways are pleasant ways, and all her paths are shalom, peace. Someone with OCD, I don't think will really be fully cured by being made aware of these quotes, but it could be helpful, as an adjunct, just to keep in mind that the idea of religious practice is really supposed to be something beautiful and connecting and helpful for your life and making life enjoyable. And so when your life is turned upside down by it, that's a time to realize that, it may be OCD and not just my religion. So just to summarize here, and then we'll open it up if anyone has any questions. OCD comes in many colors, but the fundamentals are the same. There's obsessions, there's compulsions. It could be contamination OCD, the obsessions about having germs and washing my hands. It could be thoughts that I'm a pedophile, I'm always avoiding kids. It could be thoughts I'm going to harm someone, so I'm hiding my knives. But it's always these obsessive thoughts, and the person is not more likely to engage in that behavior. They're just so afraid of engaging in it that they have these constant thoughts and fears and worries about it. And so they're constantly trying to do things to decrease their distress. And those are the compulsions. But it doesn't stop on its own, it just keeps itself alive that way. And so religion is just one of those colors that OCD can present itself in. Religion does have its own nuances. We spoke about before about collaborating with the rabbi and differentiating religious OCD from standard religious practice. Religion does not cause OCD, so I want to stress this point again, but it is a breeding ground for people who have OCD. So if you are religious, you're not more likely to get OCD, but if you are religious and you happen to have OCD, you're likely going to have your OCD symptoms, some of them at least, get in the way of your religious practice. Treatment for OCD is exposure and response prevention, as we just discussed. And it's the same treatment for religious OCD, but you want to collaborate with a rabbi so that you can get to the exposure, but not cross the line where it's actually engaging in behavior that's not sanctioned by the religion. And for more information, you can visit us at myocdcare.com. And we'll open the floor for questions.
That was really awesome, and I'm so glad we have that filmed because I think it would be a really helpful resource, both for rabbis, who may not be aware of this OCD presentation, but also for people who are not familiar, or those people who treat OCD but aren't familiar with the specific presentations within scrupulosity OCD among Orthodox Jews. So this was really great. Thanks so much. So far,
Thank
I have one question brought to us by Ari Bencher. An interesting question. So we'll see. We'll see what we could do.
Okay. Is there such a thing as a marriage that's built on commonalities of religious OCD, or perhaps one having OCD and the other being enamored by the partner? What are the implications for the children? So this does sound like a very deep question, very complex. I would say that, of course, in a marriage, there could be a commonality of religious OCD where both partners may be, connected with each other or currently connect with each other about their religious OCD. And on the one hand, you can see how it might each person's OCD might exacerbate the other person's OCD, and that can be an issue. At the same time, it could be a really supportive environment where each partner can really understand the other person's OCD and provide the support that they need to get through it. So I think, like everything in life, there are pros and cons to that, but it could definitely be turned into a tool, I think, where they can actually help each other out much more than if only one partner had religious OCD and the other partner didn't know how to handle it. So I think it could go both ways. In terms of implications for the children, I mean, there are some genetic factors when it comes to OCD, like hereditary factors. And so people who are, first degree relatives of people with OCD are at a slightly higher chance for having OCD. When OCD develops in childhood, then that hereditary rate is even stronger. And so it's something you'd want to look out for. But what's really cool about it is if you already have religious OCD or OCD in general, then you can be prepared for how to help your children at an early age to deal with their OCD, where it might not actually develop into OCD, helping them deal with uncertainty, not engaging in compulsion. So you want to provide this environment that's validating and loving and supportive while not accommodating, right? You don't want to accommodate the obsessions where you're giving in or doing the compulsions for your child, but you could definitely be supportive and validating as they go through that struggle and hopefully prevent them from, experiencing a severe level of OCD. But yeah, that was a really great question. Thank you.
That was very well fielded. It seems like there aren't other questions, but as Dr. Appel said, feel free to reach out to info@myocdcare.com or go to myocdcare.com for any other questions or if you know someone who might need help for this. And thanks for all of you who were able to join us. And this video will be available on our YouTube channel at youtube.com/myocdcare. And thank you very much, and have a good night, everyone. Get home safe.
Thank you everyone for joining. Take care.